So we all know non-communicable diseases,
Mhm.
things like heart disease, diabetes, they're a massive global challenge.
It's huge. Absolutely huge. They account for, what, 71% of global mortality?
Exactly. And the burden is particularly heavy, really disproportionately so, on low and middle income countries, LMICs.
That's right. It's a major, major issue there. And a common idea, some of this worked elsewhere, is these health taxes.
On tobacco, alcohol, sugary drinks, that kind of thing.
Yeah, exactly. The idea is, well, twofold. Discourage people from buying them and maybe raise some money for health programs. It's seen success in high-income countries.
Okay, but here's the core question for today, I think. What does it really take to make these taxes work in LMICs? Because the situation on the ground, the context, it's just vastly different.
That's precisely what we're digging into. We're looking at a big scoping review that really tries to unpack the political side, the economic factors. It's not just about the tax itself.
Right. So what did this review find? What's the framework here?
Well, it uses this really helpful lens. They call it the policy triangle. So it looks at the policy content share, but also the actors involved, the whole process, and the wider context.
Okay.
And the key thing, the really crucial bit, is that it's the interplay between all those things. It's not just one factor.
Ah, so you can't just look at the tax rate in isolation.
Exactly. A perfect policy on paper can just fall apart if the politics aren't right or if certain actors block it. It totally shifts how you have to think about it. Good intentions, not always enough.
And I bet one group of actors comes up a lot, the industry.
Oh, absolutely. That was striking. It's something like 88% of the studies reviewed mentioned industry influence. It's almost everywhere.
Wow, 88%. So what are they actually doing?
It's a whole range of tactics. They frame the taxes as job killers, bad for the economy, for GDP.
The standard playbook, yeah.
Right. They might suggest it'll just lead to more smuggling. They also do a lot of, corporate social responsibility stuff to look good.
Yeah.
And direct lobbying, of course.
And the result? Policies get watered down, delayed.
Often, yeah. Stalled, diluted.
Mm-hmm.
And sometimes there's this regulatory chill effect.
Regulatory chill, meaning governments get scared to even try.
Precisely. They become hesitant to propose future measures because they anticipate the fight. It has this wider kind of dampening effect.
Okay, so that's a huge hurdle. But things do sometimes succeed. What makes the difference? What drives these policies forward?
Well, political leadership is key. Really strong champions. Think a president, a minister of health, someone who really pushes for it.
And presumably they need good arguments, good evidence.
Definitely. Evidence-informed advocacy makes a huge difference. But that leads to another challenge.
The evidence gap.
Exactly. Especially good, solid, country-specific data in LMICs. It's often just not there.
And industry jumps right into that gap, I imagine.
They do. They often promote their own evidence, which, might be biased. And what's interesting is the review also talked about needing political evidence.
Political evidence, what does that mean? Like understanding the power dynamics.
Yeah, basically understanding who holds the power, what's politically feasible. It's not just about the health numbers or the economic models, but the actual political landscape. That's often missed.
That makes sense. What about within the government itself? I mean, health taxes must create some friction, right? Like between the health ministry and, say, the finance ministry.
Oh, absolutely. Big conflicts can arise there,
Okay.
or with trade ministries, too. And often, the economic arguments tend to win out because those ministries might have more clout.
So how do you bridge that?
One effective way is framing it as a win-win, showing that, yes, it's good for health and it brings in revenue. That can get different ministries on the same page.
Okay, so internal dynamics matter a lot. What about external help?
Crucial, especially for LMICs. Multilateral players, the WHO, the World Bank, IMF, they provide really important technical support, sometimes financial support.
Helping them build capacity, maybe counter some of that industry influence?
Exactly. And countering the influence of the big transnational corporations. Plus, you have global agreements, like the Framework Convention on Tobacco Control, the FCTC. That provides momentum, a sort of blueprint.
Right. Okay, so wrapping this up then. What's the big picture takeaway for you, the listener?
I think it's that successfully getting these health taxes in place in LMICs is, well, it's really complex. It's not straightforward at all.
Yeah, it's this intricate dance, isn't it? You've got these powerful industries pushing back. You need the political will. You need the right kind of evidence.
And you need to navigate those tricky relationships between different government departments. It all has to come together.
So this deep dive really highlights that you have to understand the whole political economy behind it. It's not just a health issue or an economic issue in isolation. Which leads to, I think, a really important final thought for you to consider. If we know it's about more than just health stats and economic forecasts, what kind of new research do we really need? What do we need to understand better to effectively navigate these powerful forces and actually improve health outcomes globally?